Yourself, thank you very much for this. So my name is Christopher Lydell. I'm a rheumatologist. I came to Canada in 2007. Working in Cape Town in a very, very big hospital in which we had a very impressive musculoskeletal unit, which consisted of rheumatology, rehabilitation, clinical psychologists, OTs, physios, 11 super specialized orthopedic surgeons, all working in one environment. And it is a model as to how musculoskeletal services in communities can be delivered. And I actually received a telephone call from a recruiting officer in Grand Prairie in 2006 to ask if I would like to come and consider relocating to Grand Prairie in predominantly internal medicine. So I actually came over and met them. I had an introductory period, met all of the staff and made the commitment, which I think at that time the contractual period was 3 years. Made the application in November 2006. I was working by the 7th of July 2007. When I arrived, they still hadn't decided where they were going to build their new hospital. Spent my 7 years there in a community medical practice with a number of family doctors. We offered a very, very good service. We got rheumatology done in the north, got up satellite clinics in the Peace River area. We established very good support systems with the far north. Just one of the things that struck me at the time was just how fragmented services were. Orthopedics over there, rehab over there, community-based. But one of the reasons that I always tried to emphasize the importance of this was how many patients per unit population have rheumatoid arthritis? Do you know how many of them will require biologics? Do you know that untreated, what the number of patients are going to require joint replacements? Do you know what the cost of biologics are? Do you know what the cost of failed biologics are? Do you know what the cost of failed treatment is? Because these are the things that are going to impact your budget. In 2012, things went south, but morale in the hospital collapsed. Number of family doctors started to leave. There were mass retirements. So morale took an absolute dive. Everyone was extremely distressed. 1 in 3 does not have a family doctor or has just lost them because of retirement. The smaller communities, there's a mass exodus at the moment for various reasons, which is most unfortunate. But it's not just the failure of primary healthcare. As that system fails, everything behind it fails. So you can't get a rotator cuff seen in a general practice environment for months. We also have a major problem in the hospital. You've seen that. So just from the point of view of rheumatology, and I mean, if we extrapolate this to neurology and to mental health, I think you can see just exactly my concern is this tsunami of problems are going to come down, and they're starting to come down. It's entirely the economic model. The current financial model of supporting a primary care practice is not there. There has to be greater involvement and family doctors, particularly, and itinerant consultants coming into their communities to at least maintain services. They are very committed to trying to help. Dr. Parks, whatever I can do to contribute to try and make our system work, I will do.